Many women want to know about pregnancy even before their period is due. The waiting period feels endless. Every small sensation becomes a question, every cramp becomes a possibility, every mood swing becomes a sign, and the most common question I hear is, "Doctor, is there any way to know before my period is missed?" Let me be honest with you. There is no 100% guaranteed sign of pregnancy before a missed period, but there are early changes your body may start showing, sometimes even before your expected date. Today, I'm going to explain those early signs and symptoms that may appear in the very first month of pregnancy. I'll tell you what is normal, what is not normal, when you should stay calm, when you should be alert, and the correct time to take a pregnancy test. Let's start with one of the earliest sensations many women report: lower abdominal discomfort. Lower abdominal pain or heaviness is very common in early pregnancy. This discomfort is usually felt below the navel. Some women describe it as stretching. Some feel mild cramps, similar to period pain. Some experience dull lower backache. Why does this happen? Normally, the uterus is a small organ. It quietly sits in the pelvis and only changes size significantly during pregnancy. But once implantation happens and pregnancy begins, blood supply to the uterus increases rapidly. The uterine lining thickens further. The surrounding tissues begin preparing to stretch. The body is not used to this sudden increase in circulation and growth signals. The nerves interpret this adjustment as discomfort. Mild pulling or cramping is normal. It is part of the uterus adapting to early pregnancy, but listen carefully. If the pain becomes sharp, severe, keeps increasing, or is associated with heavy bleeding, dizziness, or fainting, that is not normal. That requires immediate medical attention. Early pregnancy pain should be mild and manageable, not unbearable. The second early symptom is frequent urination. Suddenly, you feel the urge to pee more often than usual. You may even think, why am I going to the bathroom so much? Even before the uterus becomes large, hormonal changes begin affecting pelvic circulation. Increased blood flow to the reproductive organs and rising progesterone levels can create a sensation of bladder pressure. The bladder sits just in front of the uterus. Even subtle changes can give you the feeling that your bladder is full when it's not completely full. This is normal in early pregnancy. Just make sure you drink adequate water and do not hold urine for long periods. However, if frequent urination is accompanied by burning sensation, itching, fever, cloudy urine, or blood in urine, that suggests infection, not pregnancy. In that case, you must consult your doctor. Now let's talk about increased white discharge. Many women say, "Doctor, I keep feeling wet, as if my period has started." Increased vaginal discharge is common in early pregnancy. This happens because progesterone levels rise significantly. Progesterone increases blood flow to the uterus and vaginal tissues, which leads to increased fluid production. This discharge is usually milky white, thin, and without foul smell. It may make you feel moist throughout the day. Maintaining good hygiene is enough. You may use panty liners if it feels uncomfortable. But if discharge becomes thick like curd, has a bad smell, causes itching, burning, irritation, or contains blood, then it is not a pregnancy sign. It may be infection and should be evaluated. Next comes breast tenderness and changes. Breasts may suddenly feel heavy, sore, sensitive, or painful when touched. Some women notice that their breasts feel fuller. The area around the nipples, called the areola, may darken slightly. Small bumps on the areola, known as Montgomery glands, may become more visible. Why does this happen so early? Because the body immediately begins preparing for breastfeeding once pregnancy hormones rise. Progesterone and estrogen increase blood flow and stimulate breast tissue growth. Milk production will not happen until later, but preparation begins early. Wearing a supportive and comfortable bra can help reduce discomfort. Avoid tight bras that increase sensitivity. Now let's discuss mood changes, dizziness, fatigue, and sleepiness. Hormones influence the brain just as strongly as they influence the uterus. Rising progesterone can make you feel sleepy and tired. You may feel exhausted even without heavy physical activity. Some women describe it as overwhelming fatigue. You may also feel emotionally sensitive. Small things may irritate you. You may cry more easily. This is because pregnancy hormones affect neurotransmitters in the brain. Mild dizziness can also occur due to changes in blood pressure and blood circulation. Early pregnancy slightly alters vascular resistance, which may make you feel lightheaded occasionally. Rest is important. Try to sleep sleep at least 8 hours at night. Take short naps if needed. But if dizziness is severe, persistent, or accompanied by fainting, that is not normal and should be evaluated. Now let's talk about nausea and vomiting. Nausea is one of the most well-known early pregnancy symptoms. It may start even before a missed period in some women, though it is more common after the period is missed. The hormone responsible for this is human chorionic gonadotropin, also called HCG. Many women feel mild nausea in the morning. Some experience food aversions. Certain smells may suddenly feel unbearable. You may develop a metallic taste in your mouth. Doctors often consider mild nausea as a reassuring sign because it suggests rising pregnancy hormones. But nausea varies. Some women have none, some have severe vomiting. If nausea is mild, eat small, frequent meals. Do not stay hungry for long periods. Avoid oily, spicy, or heavy foods. Sip fluids throughout the day. If vomiting becomes so frequent that you cannot keep fluids down and you start losing weight, that requires medical management. Another early possibility is light spotting before the expected period. This is sometimes called implantation bleeding. It may appear as light brown or pink spotting and usually lasts for a short time. It is generally lighter than a normal period, but heavy bleeding, like a regular period, is not implantation bleeding. And if you have heavy bleeding after a positive pregnancy test, consult your doctor immediately. Now let's come to the most important point. There is no completely reliable sign before a missed period. Lower abdominal pain, breast tenderness, discharge, mood changes, nausea, all of these can also occur in the premenstrual phase. That is why symptoms alone cannot confirm pregnancy. The real confirmation comes with a missed period followed by a positive pregnancy test. If your cycles are regular, wait at least 3 to 4 days after your missed period before testing. Use first morning urine because hormone levels are most concentrated then. Avoid drinking too much water before testing, as it can dilute the hormone concentration. Read the result within the recommended time mentioned on the test kit, usually within 2 minutes. If one line is dark and the second line is faint, it may still indicate early pregnancy. Repeat the test after 24 to 48 hours because HCG levels double approximately every 2 days in early pregnancy. If your period does not come and the test is positive, pregnancy is confirmed. If your period does not come but the test is negative, repeat it after a couple of days. If periods remain absent, consult your doctor. I understand the anxiety. I understand the excitement. The waiting phase is emotionally intense. But remember, your body needs time. Hormones need time to rise to detectable levels. Testing too early often leads to confusion and unnecessary stress. If you experience severe abdominal pain, heavy bleeding, shoulder pain, fainting, or severe dizziness, seek medical attention immediately. Those are not normal early pregnancy symptoms. Early pregnancy is delicate but natural. Trust your body but confirm with science. Do not rely on myths, internet rumors, or guesswork. Share this information with someone who is waiting for good news and feeling anxious. Let them understand what is normal and what is not. This is Dr. Iris Amelia. Stay informed, stay calm, and I will see you in the next discussion.